healthcare. You're putting a plan together. Say I mean, there's a plan, something's going on to address this Affordable Care Act subsidy stuff set to expire in less than 6 weeks. This was obviously a key part of the debate and the government shutdown and all that ended after a 43-day stalemate. So what reforms is the GOP looking at exactly to kind of help on the healthcare issue? And how much support on the Republican side would there be to extending these Obamacare subsidies? I'm assuming not much, but what's your sense of that?
I don't know what you guys think, but I think this has been really a good moment here where Chuck Schumer shut us down for 6 weeks to ensure that they'd win in Virginia and New Jersey. But it elevated this issue, and you have more Americans now that are saying, okay, so what is the problem with Obamacare? We know we're paying far too much for health care, so that certainly appears to be a problem. So in order to fix a problem, you first have to identify you have a problem. I think that has happened. Now, how do we deal with the solution? And I'll tell you, one of the key ways that I'm focused on is essential health benefits, which was in the Obamacare law. It put mandates in place that basically mandated high-cost health insurance. And so if you can afford it, and the Democrats are defending those people that are making $500,000 a year, that they are able to access Obamacare, we need to make sure that those people that are getting health care also include the lower income, because they've got fewer choices at this point as a result, in part because of this essential health benefits provision in there. That needs to be reformed so that we can get people some low-cost health insurance that works for them rather than the high-cost insurance that Obamacare is.
Yeah, I mean, it just seems to me like so often the private sector could play such a major role. What is it going to take for us just to go back to the way medicine worked pretty well? My whole family were doctors. I remember they used to make house calls and all the things, and it was such a much better system then. What would it take for us to go back to the way it used to be, where it was just really, truly privatized and individual?
I think there's three key words, Gina: choice, competition, transparency. That's what's been eliminated. Think about the massive conglomeration of hospitals that we have now.
Yes.
I mean, we have taken away the family doctor that you're referring to. Mm-hmm. We need to give more choices. And that's why this essential health benefits provision is so important. If we would stop those mandates and allow people that want to have lower cost health insurance, if we gave them that option, we gave them that choice, they would have better health insurance that fits their life, not some bureaucrat in Washington's ideal of what healthcare should look like.